1340 96.5 KVGC is promised in the studios with us today. We have Dr. Bob Hartmann, Dr. Rita Kerr, Amador County Public Health Officer, and Tom Dickson, CEO of Sutter Amador Hospital. Welcome, my friends. Welcome.
Good morning.
Good morning, Dr. Kerr. So we had a story this morning that basically had some good news in it, and it said that a bit of good news, statewide positivity rate for the virus over a 7-day period has fallen below 10% for the first time in weeks, meaning statistically that each infected individual was now infecting less than one other person.
That is good news, and actually I heard you say that this morning. I looked up Amador County, and ours is at 9.8%, so we are below 10% for the first time in weeks as well.
That's good. That is good. That is good. So how is it out on the front lines there?
What we're seeing is a decrease in the daily case rate count, which is good news. We did see a bump after the holidays, both the Christmas holiday and the New Year's holiday. We are continuing to see some people still connected back to those gatherings that, it went to one household member and then another household member, so it's still kind of transmitting through. But the daily case rate is falling, and that is good news.
Okay. Statewide and nationwide, the death rates, what's the demographic in those? That's really never released. And so is it elderly? It
is generally elderly. The highest risk individuals are those over 80, and then the next highest risk are over 70, and then the next highest risk is over 60, and that's really almost regardless of other underlying conditions.
Sure.
And the death rate will probably continue to climb even as case rates fall because it lags a couple of weeks. Actually, the hospitalization rate lags about 2 weeks after the case rate, and then the death rate lags a few more weeks after that.
Okay. And how are we doing on vaccine on dosage?
That news that you got from about the Moderna lot is good news. Amador County did get a substantial amount of that, and we had actually administered about 350 doses from that lot in clinics the beginning of last week before the state advised us to pause the use. We have 46 vials of it left in our freezer, and so we are glad to hear that the allergists and the immunologists and the experts who looked at all the data, interviewed the people at the clinic in San Diego where it happened, have determined that it's safe to use. And I want to reassure those people who got it that it was a valid dose, a good dose, and if they were going to have a reaction, it would have happened before they left our clinic. That's why we observe people routinely for 15 minutes after a shot. And for those people that are prone to allergies, we actually observe them for 30 minutes after they have their vaccine.
Most of the people that I've talked to that have had the vaccine, it's made them either sleepy or a little sore in the arm, nothing at all.
I'm going to let Dr. Bob speak to that because he's interviewed quite a few people about what kind of side effects they've had.
Dr. Kerr and I and others at Public Health have talked with probably hundreds of people who've had the vaccine and asked them about side effects. Almost uniformly, people will get a sore arm. Most people say that it's a little bit worse than a flu vaccine. And then a few people with the first dose had other more systemic type symptoms, low-grade fever, or generalized achiness, but that was very, very few. With the second dose, we have, as expected, seen more side effects. The arm, again, sore. Some people have reported, in more than with the first dose, some people have reported some fever. Some people have reported general malaise, just feeling yuck.
Yeah.
Personal experience. I received my second vaccine about 10 days ago, and my arm was sore like the first one. The next day, I had about an hour or two of just feeling a little bit more fatigued. I did take some acetaminophen. I did take a little ibuprofen, drank a lot of fluids, and bounced right back from it. A number of people are also with the second dose reporting a little bit of discomfort or lymph node swelling in the armpit of the arm they received it in. Most people just saying they notice it. I noticed it taking a shower, about 2 days later. And I just, I almost burst out with glee because that means it is working. When you do get these side effects, and at least the experience here in the county has been, most of them have really been mild, but it means your immune system is reacting to it. So you start making antibodies, which is the important thing about this vaccine. Jim, it really, and I probably said this to you before off the air, it is a miracle drug. It works well. A vaccine that's 95% effective 2 weeks after your second dose is just amazing.
How many people have had the second dose in the county? I mean, hundreds?
Yes, in the hundreds.
Yeah,
We
yeah.
actually, that's been our focus this week because we didn't have inventory to do first dose clinics this week. We focused on those second dose clinics, and we've
Okay.
been getting those second doses into people. The hospital's been getting second doses into their healthcare workforce, and we've been getting second doses into the first responders and those healthcare workers that aren't affiliated with the hospital, those phase 1A folks who got their first dose 3 and 4 weeks ago.
Let's ask Tom. Tom, a lot of talk around, the hospital is impacted. There's no room at the inn.
Right.
Is that true? How's the hospital faring through all this?
I would say, recently I think that's been true. We start every day near capacity or at capacity, and that's actually not unusual for many hospitals, though, under even normal circumstances. You have people that come into the emergency department. You diagnose, you hold them potentially for a little while. You have discharges, and so we're able to pretty effectively and very smoothly transition the care as we need to. We've been able to handle it pretty well.
If I came to the emergency room and said, I've been short of breath, I'm exhibiting all the symptoms of COVID.
Yeah.
Okay. Do I get admitted to the hospital? Do I get treated and sent home? What's the...
Any of those could happen, but you'll get evaluated by first, a triage nurse, and then you'll be seen by a physician or a PA as appropriate, and they'll order tests, they'll diagnose, they'll come up with a plan. So they may decide that they want to just hold you for a few hours and just observe you. They may decide that we need to admit you and keep you overnight. It just depends on your conditions and the assessment.
Go ahead,
I'd like
Dr.
to
Kerr.
mention that there's another very effective therapy, and that is the monoclonal antibody treatment that in certain individuals who are above the age of 65 or have certain underlying medical conditions, if they get diagnosed with COVID within 10 days of symptom onset and they're not sick enough to go into the hospital, that infusion can happen, and then they're discharged and observed at home, and they're much less likely to have to come back to the hospital for readmission.
Is that available here?
It is.
Yeah, absolutely.
In large supply? I mean...
At first, the supply was very limited. It's becoming more and more available, and it is, again, it needs to be done for people who are not sick enough to go into the hospital and done in a very timely manner.
Tom, a question back to you again. One of the comments that we had to ask one of the questions. Is it true that Mule Creek prisoners are taking ICU beds? And does the state not have its own medical facilities that once they're stabilized at Sutter, they could be taken to one of the state facilities?
So it is true that Mule Creek patients end up in our critical care unit, as well as other patients. To date, we've been at capacity, but we've not had a situation where we couldn't handle providing care to all patients who need that level of care.
Right. Okay. Did you want to go on, Dr. Bob, about the vaccine at all? No, that you covered everything.
I would just like to say that Sutter Amador really has done a remarkable job. Kudos to their staff. This has been going on since March, and March of last year. People get fatigued, but the staff there has just done an outstanding job of keeping up with what needs to happen. And in addition to providing care for Mule Creek, because we are the closest acute care facility to Mule Creek. People get really sick there, come here. But they have maintained the ability to take care of anybody from the community who comes in also. And as being part of the Sutter system, they get, they're able to get supplies that other hospitals might have a hard time getting, able to keep up with the PPE. And Very rarely do people need to be transferred out of our community. Most of the time is for something very specific, very specialized care. For instance, not a lot of people realize that coronavirus can actually contribute to heart problems. You can get inflammation of heart muscle. And so there's been some people that have needed to be transferred out to a higher level of care with coronavirus because of that. But it's not that we were bursting at the seams and couldn't take them in.
Wow. So, Dr. Kerr, do we have, again, one of the questions, where do I sign up to get a vaccine? I'm 65 years of age. The question is, I'm 65 and, where do I go? I went the other day on to try to get my dad and Etta one, and I could get one for them in Folsom. If I could take them to Folsom, they're 95 and 96. They didn't want to travel to Folsom, so we're waiting for one locally. Will there be one locally, and where do you go if you're 65?
Okay, at this point, we have enough vaccine now with the release of the Moderna lot and the new allocation that we just learned about that will be shipped to us next week to start offering the vaccine to 75 and older here in Amador County.
Okay.
So people should go to the Amador County website and sign up for e-notifications. It's on the home page. There's a button you can press to sign up for e-notifications, and when you get to that e-notification page, you have to put in your email address, your name, and then you're going to want to click the little envelope that says health and safety notifications. When we have schedules open up for a clinic, they will be posted, and everyone who signed up for those health and safety notifications will receive notice about that clinic sign up. Because the allotment for next week is still relatively small, it's still in the hundreds of doses, and we're going to have 2 clinics next week targeting people 75 and older, and then we're going to have our second school staff clinic next week. The first one was yesterday. We are already working on planning with multiple community partners and agencies a large-scale drive-in and park style clinic in the first half of February.
Okay. That was going to be my next question. There's rumor going round that there will be a drive-through clinic.
It's not going to be drive-through. You're going to have to park. You're going to have to stay there for 15 minutes after your injection, or 30 minutes if you're prone to allergies. So it will not be as quick as driving through to get the COVID test
Okay.
was.
So we would go to some large area like St. Catherine Drexel, because they have a lot of parking spots out in front.
Yes.
You would just go park there, and then someone would come
Go through
your
your
car and ask you.
registration and your screening. You'd get, after you pass through that, you have your dose administered, and then you're going to have a piece of paper on your windshield, something like that, saying what time you're eligible to leave if you don't have any problems, and what instructions if you do have problems, and we'll have people observing those in the cars while they're waiting.
Gotcha. This is the most animated I've seen you in months.
I talk with my hands, yes.
No, I'm serious. I mean, and even though you're wearing a mask, I can see there's a smile on your. Are you feeling?
This vaccine gives us hope. I mean, Dr. Bob's expressed that multiple times, and we're really very grateful for all the work of all the partners. The hospital's been a fantastic partner with public health and has, been doing the frontline work, really. And now, thanks to our fantastic volunteers, and we're continuing to sign up people through our disaster healthcare volunteer system to help out at the clinics, because there's no way our small staff of 14 public health people could do all this alone. We're relying on American Legion Ambulance, who's already set up several point of distribution for vaccine for first responders. And in fact, some of their medics were at the school clinics yesterday helping administer a vaccine to teachers and staff. So it's really taking a community to do this.
Back to Tom again. So Tom, the hospital fully open, surgeries, checkups, whatever, it's all.
Yeah, we're putting a pause or a slowing down or even a hold sometimes on elective surgeries right now, just because of, that's really the direction from the state, and that is an important thing for us to do, to concentrate just on providing critical care services as we can. And could I just say, though, that just consistent with what Dr. Kerr did, we have an amazing hospital. We have a phenomenal staff, and I think it's a testament to their commitment that they're able to do what they're doing for so long. But we couldn't do it without our partners either. Like the county is a phenomenal partner for us. They help us with a variety of things. The county and the state both got us additional staff recently. They got us a critical care nurse. We had 5 paramedics show up last week. we get advice, we get equipment, we get vaccine. I mean, so it is.
Sure.
It's a all hands on deck kind of thing. Sutter Health is able to lend us assistance whenever we need it. So we're doing great, but it's really because all the help that we're getting.
Are the Sutter Health doctors doing vaccines in their office, like Dr. Rowland? Are they doing?
Jim, at this point, Sutter Medical Foundation, Sutter Medical Group, which is the primary care clinics like Dr. Rowland,
Right.
Dr. Fields, et cetera, they are beginning vaccine rollout, as a matter of fact, later this week. And they will be doing vaccines not in their offices, but in another location.
Gotcha.
And what I went online this morning to sign up to see if there was anything available, which I'm sure you have done numerous times. And although they already have, I think, 4 clinics scheduled, all of them are full at this point. And as they roll out, as they get more vaccine and as they roll
Sure.
out more appointment slots, those will become open. And so people can go to Sutter Health website, or they can go to My Health Online and get that information.
So to clarify that, the clinics that are full are out of the area. They're not. No, they are here.
There are clinics that are starting in area.
Okay.
Sutter is doing that throughout their footprint in Northern California. Some places are having very large clinics. In Amador County, they are starting with small clinics, and then as they get experience with it, ramping up
Gotcha.
the numbers. But they will be, for instance, between now and the end of the month, they will be vaccinating somewhere over 400 to 500 people, which is great. You know, any partnership that we can have.
Here's a question that came in. As an essential nonprofit, I have a few volunteers wondering when and if they will be eligible.
At this point, the state is moving on a whole to prioritizing age-based vaccination. So the phase 1A, which is the healthcare workers, the first responders, they continue to be eligible, but rather than now going industry by industry and trying to figure out how to prioritize one industry over another, we're really moving to an age-based framework. And the reason is exactly what you asked me about before, Jim. They're at the highest risk for death. They're at the highest risk for hospitalization. And so we're really shifting the prioritization strategy to, again, 75 and older first, and then as supplies allow, we will go to 65 and older.
Gotcha.
And Jim, in the county, there have been thousands. I say thousands. So we think that there's somewhere around 2,300 vaccines administered already, and a significant portion of those, if not all of them, have gone to frontline workers, to the phase 1A group. We still, when we open up clinics, we figure, well, there's some that we probably missed, some healthcare workers.
Right.
They were on vacation, or they couldn't come into one of the clinics, whatever. So we're still making as we open up the clinics 75 and over, we are also making it available to healthcare workers who might have missed one of the clinics that we've done or that have been done through Sutter Amador Hospital.
The way I've heard that described is, think about the way Southwest boards their airplanes. Group A gets to board first, but if they show up at any time during the boarding process, they continue to be able to get on the plane. So the phase 1A group can continue to access vaccination throughout the vaccine rollout. Now we're adding the 75 and older at this point.
Another question, we've already covered it, but we'll just mention it. The Moderna vaccine, able to use, no problem with that. Here's one. How, when, and where do 65-plus folks get the COVID vaccine? I've tried to sign up with updates on the county website. It keeps giving me code after code. I finally gave up.
Jim, as Dr. Kerr said, we are focusing on highest risk groups. So we're going 75 and over. It appears that the recommendations from the state are going to be for the next level of prioritization to be 65 to 74 with chronic medical conditions, and then open it up 65 and up. So we can't roll it out as vigorously as we would like to because of supply. And so we have prioritized to the highest risk groups.
Bob, how are you doing this with, for example, I've heard of this the other day, someone who's 75 married to someone that's 63?
Jim,
living
we still,
in the same household. What do you do with that? I mean,
you know, that we recognize that dilemma. The 75-year-old is at more risk than the 63-year-old, and we're going to have to go with that age-based risk at this point, and then we'll get to the decade below that, below 75, with people with high-risk conditions.
All right, Dr. Kerr, here the question. I'm trying to take notes. Can you please have Dr. Kerr run through how to find the appointments on the health department website?
Okay. The health department website at this point does not have appointment sign up, but what you can do is sign up for notifications when those clinic appointments are available. You go to the amadorgov.org website. That's the main website for the county. And on the homepage of that website, there is a tab that says sign up for e-notifications. If you hit that tab, you will see a page that has you enter your email address and your name, and then there's a display of a whole bunch of little envelopes that you could click on. The one you want is health and safety. It's at the lower left corner of the page.
Okay. Got
And
it.
then once you've done that, you will get a confirmation email, and then you open that confirmation email, check your spam folder for it if you don't see it, and you just verify that, yes, I really do want to sign up for this.
All right. So the testing now, that seems to kind of, everybody's all excited about the vaccine, but the testing still very important.
Testing is extremely important to continue to test to see what the rate in our county is for contact investigation or case investigation. Contact tracing is very important. And we have gone through a transition from the St. Catherine Drexel Verily site, and our extreme thanks go out to St. Catherine Drexel, wonderful partner for 7 months and having the clinic there. We have shifted it to the Health and Human Services building off Lower Ridge Road. During good weather, it is outdoor testing where the staff comes to your vehicle. Bad weather's coming in and we're going to have to move inside. But it's Monday, Wednesday, Saturday, and it is from 7 a.m. to 7 p.m. We're really excited about the longer hours to catch people that had difficulty getting in for testing previously. You sign up by going to lhi.care/COVID testing, and that will take you to the website where you sign up. Also on the Amador County website, there is a phone number that you call, and you can register that way. Some people have a difficult time doing either of those, and they do on-site, same-day registration. I tend not to like to do a lot of that because it slows them down, but certainly that can be done, and the crew there has their iPads, their computers, and they can do it right there in the parking lot or in the building. And so we're really excited about that, and it, again, is Monday, Wednesday, Saturday.
Tom, how does that work? Do you administer tests at the hospital for people that come in for procedures?
Yes, for any kind of surgical procedure or any kind of.
So we don't have to go for a test like this. We can, if you're going,
you can get it done right at the hospital. Yeah,
at the hospital. All right. Okay, we've got Dr. Rita Kerr, Amador County Public Health Officer. Tom Dickson, CEO, Sutter Amador Hospital. We're going to call you Deputy Public Health Officer because I was just informed by my accountant. If I say you're an employee, I do have to really pay you.
I'm waiting for my 1099 from last year.
For your badge. All right, let's put on our. Let's get out our crystal balls.
Mine's broken.
It's going to happen. Okay, so first off, it's a question for you. We're not really hearing much about colored tiers anymore.
Right.
Are we still in colored tiers?
Yes, we are. When we came out of the regional stay-at-home order, we were assigned to the color tier that our data indicated at the time, which was purple. That happened on January 12th.
Right.
In order to come out of the purple tier, we need to get our case rate below 7 per 100,000. Right now it's at about 23.
Oh.
We need to get our testing positivity rate down below 8%. It's at 9.8%. That's why that testing is so important, because we need to be able to demonstrate that our case rate's falling and that our background community levels are really low in order to go down into the red and then the orange and then the yellow tier.
So that first one you gave us, which we're still pretty high away, what's the chance of getting there anytime soon?
I think it's going to be
months?
At least a month out.
At least a month out.
Because that data is updated and is always that 7-day snapshot with
Yeah.
a 7-day lag. Last week's looking pretty reasonable, but we're not down to less than 7 per 100,000 yet.
So let's look further ahead. Do you think, I mean, I guess this all depends on the vaccine rollout and how long do you think it will take to get everyone vaccinated in the county? Is there an estimate on that at all?
Jim, at this point, we don't have an estimate. I'm very optimistic with the rollout thus far, other than the supplies have been a little bumpy over the last week or two. But we've been able to vaccinate a huge number of the healthcare workers in this county, and moving through Phase 1A faster than many California counties. It's going to take a major effort and help from our community partners to get to the large age groups. There's probably 10,000 people will be eligible for vaccination when we start to look at the 65 and over in Amador County. That's going to take a major effort.
The big question is fair, which is coming up in the last part of July. Are we going to be ready for then? Will we still be wearing masks then? Will people be afraid still to come out in groups then? Where do we stand? Now, you three have all been vaccinated even with your second round, correct?
Yes.
And Bob, you said you're 10 days into the second round. It has to be 21 days before you're fully.
It's actually about 14 days after.
Okay, so you're still wearing masks. Are you wearing masks to protect me from you, you from me? How long do we have to wear the masks? Will we still have to wear? You follow what I'm getting at?
Yes.
Because I mean, people have already bought their steers.
Right.
You'll understand that. I mean, but now it's like small animals, and what do we do here?
Multiple layers to that question, and I'm going to go backwards and talk to the mask first. Right now, the vaccine's considered an additional layer of protection on top of all of the things we've already been doing, and that partly because there's not enough people who've had the vaccine in the community yet to really start to have a significant amount of herd immunity to protect others. The other thing that is still being studied is whether or not after a vaccine, if I was exposed and had a low level of the virus in my system, not enough to make me feel sick, but is it enough for me to still spread it to others? So this mask is for source control, to protect you from me for the time being until we've learned more. And, now that there are millions of people being vaccinated, we're going to learn these things much more quickly than we would during the couple of 100,000 people who got it in clinical trials.
That was actually one of the questions that was asked. Can you still be a carrier once you've been vaccinated?
And the answer is we don't really know yet, and that's why we still wear the masks.
All right.
We are waiting for official word from all the scientists, the CDC, the National Institutes of Health, about whether or not people who've been vaccinated get to not have to quarantine. I think that's likely, but we're not quite there yet.
Yeah.
When it comes to the fair being late July, I think there's a reasonable chance we'll be able to go ahead. I think it's, because our fair is relatively late in the season, I think there's a reasonable chance that there's going to be enough vaccine deployed and hopefully enough settling down of the surge, from this post-holiday surge is starting to taper off. We're hoping we don't see another uptick as people relax again. And that's the pattern that we've seen is we get better and then people relax and do more things, mix more, and we start to see an increase again.
I keep thinking that maybe by the third quarter, definitely by the fourth quarter, we should maybe be back to, I know Dr. Fauci said, I think it was November, this was like a month ago, said maybe by November we'll be out of the United States will have herd immunity possibly, but international immunity would be possibly into 2022.
It gets tougher and tougher to get vaccine out to those more remote areas with the current vaccines that require such strict ultra low temperature freezers and that sort of stuff. As more vaccines become available after they've gone through the process of being studied and they can be held at normal refrigerated temperatures for a reasonable period of time to get them out to a remote area, then we're going to start to see that herd immunity in more remote places.
So now with the teachers receiving their vaccines, can we open schools back up again
Well,
then?
schools here have been open in a hybrid model.
But I mean, even just without the hybrid model, just open them back up again.
For the time being, we are going to continue again to layer this vaccine on top of all the other health and safety precautions.
Okay.
And while the teachers and staff have been vaccinated, none of the children have yet. And while we know that they are less likely to get seriously ill, and at least the youngest kids, those 6th grade and younger, are less likely to share with others, that the older kids who aren't in a stable classroom all day but switch classrooms and mix with multiple people all day, they really need to continue that physical distancing.
Well, Dr. Kerr, could you, for lack of a better term, could it, like, let's say the Arts Council's TGIF series, which goes, the Music in the Park on Friday, starts in January, or in June. Would it be a crapshoot to plan that? I mean, would you say, I don't know, maybe this year might,
Outdoors are generally safer than indoors, so I think we will see outdoor events come back before we see a large indoor venue type of concert or something like that.
So you think there could be hope for the fair this year then, is what you're saying?
I think there's hope.
There's
Yes.
hope.
Yeah,
Okay.
I would agree with that. And also, most of the fair is outdoors, and it can be modified, I think, to make more of it outdoors. And so that, as we've said all along, outdoors is safer than indoors.
Okay. Here's another. I'm on the AC Health page and can't find the link to the sign-up email. Again, Dr. Kerr, can you explain? Maybe we should do a commercial on this, Dr.
Yeah, why don't we do a PSA on that, Jim?
Yeah.
I think that would be
Okay, so
good.
go to
It's not on the health page. It's on the county main page.
go to the county main page, and then there's a link there to
I'm going to
e-notifications.
pull it up on my phone right now and just make sure I'm going to talk through the process exactly how
Yeah.
I do it one last time here. So I'm going to amadorgov.org.
Dr. Kerr does not have that smile anymore.
No, it's okay. No, I want people to be able to do this.
Yeah.
I think it's really important. So I go to amadorgov.org.
Gotcha.
Don't click the red banner at the top. That takes you to the COVID page. But if you scroll down, sign up for e-notifications, and
Got it.
it has an envelope on it. Hit that envelope, and then you type in your email address and your first name and last name. And at the lower left corner, there's a little envelope that says health and safety. That's the process.
Gotcha. I'm going to that as soon as we get off the air.
Perfect. Good. Thank you.
Putting that on there.
Yeah. Also, Jim, just one more note about the vaccine. In the clinical trials, children were not studied.
Mm-hmm.
So the Pfizer vaccine, we can go 16 and over, Moderna vaccine, 18 and over. So again, with more clinical trial studies, more vaccines coming out in the near future, I think we're going to need to look carefully at when we can start to vaccinate at younger ages, because that's a substantial portion of our population. So just be aware if you show up and we had someone show up the other day. They did fit into a category of someone who could be vaccinated. They were 5 days short of their 18th birthday, and we couldn't do it. So that's another issue to consider. And hopefully we'll be able to expand that in the future.
21 days from the first shot is the first. You can have the second shot.
It depends on which vaccine you're
Okay.
using. Pfizer is 21 days, Moderna is 28 days or 1 month.
Okay, is there a time frame where that expires if you go too long?
Absolutely not.
No. So I could have the first dose right now today, and in May have a second shot as a booster?
You could have a booster as a second shot. We don't have the studies on that to show how much of a benefit it gives you. We do have the studies that show after 3 weeks or 4 weeks when you have the second dose.
Yeah.
2 weeks after that, you're at 95% protection.
J&J's talking, Johnson & Johnson's talking about another vaccine. When will that be available?
That one is in final data review, and what I have seen is they expect to submit their application for the emergency use authorization by early February.
Mm-hmm.
Johnson & Johnson is a one-dose vaccine that will not require a second shot.
That's just, and from what I understand, it doesn't need the extreme freezer and the
It is a more
refrigeration. It's
stable
more
product.
stable
It
stuff.
doesnh need to be ultra-low temperature frozen.
I was also told that you can't just take the vial of this and go
No.
shake it real hard.
No.
Take to mix it up real good. It
No,
has to be
in matter of
close.
fact, because of the way the two vaccines that we're using now are formulated, they have the active portion of the vaccine encased in a fatty layer, and that goes into your muscle in those little fatty globules, and then the active portion of the vaccine gets released inside your body. You don't want that to happen in the vial, and that's why we have to handle it so carefully.
All right.
So if you shake it up, you break that fat layer
Gotcha.
up. So, and our staff at Public Health and at the hospital, at American Legion Ambulance, are well versed in how to handle this. We've undergone numerous trainings. There's trainings that are available from CDC, from the state, and but you do have to handle it carefully. We're hoping that the future vaccines that come out will be easier to store, easier to handle, but nonetheless, we're still getting hundreds and hundreds of doses into people. As a matter of fact, we're starting our setup in 15 minutes up at the health department. I'm going to have to run and go up and, and orient one of our volunteers. We're so dependent on our volunteers, and they've been wonderful. But we have a new volunteer this morning that I've got to help orient. And
Gotcha.
It's been heartening to see people come out and to help us.
Dr. Hartmann, thank you for coming in today. If you have to go, go. Seriously, you have to go. Tom, thank you as always for coming in. Any last words from Sutter on the hospital?
Nope, we're here and we're doing our best, and we're happy to serve.
Yeah. All right. Dr. Kerr, as always, thank you for coming in and visiting with us.
You're welcome.
And I'm really happy to see you got a smile underneath that mask on there. It's been kind of rough days for you. Been dark
Jim,
days.
We talked about this ahead of time. We said all three of us have been vaccinated, so all three of us are going to show up in the studio.
There we go.
Right.
Instead of calling in on the phone, it's much better to be here in person.
Yeah.
And again, thank you so much to KVGC over the months and months of this coronavirus. You've been so helpful and so informative to our community.
Thank you. That's our job. That's why we are here, to help you guys out. So, all right, maybe one last question. If it,
Bye, guys.
Nope, that's it. Nope, they were all just. Someone sent me a picture of them getting a vaccination a couple of days ago, so that's good. So, all right, Dr. Kerr, thank you very much.
You're welcome.
Hopefully, a return to normal within.
It's going to be gradual, but we will get there.
There we go. Tom, thank you very much for coming in today.
Thank you, Jim.
All righty. 1340 96.5 KVGC.